out, all ripped up. I believe the electrical is all frayed on it. So this thing looks very nice, but it's unable to provide anesthesia. And I was prepared for that. This is called the Dre portable anesthesia machine. And you can see on the right here, I'm holding it in this box. And when you open it up, this is what you see on the left. You basically have a small flow meter. You have a sevoflurane vaporizer. You have a bag system here where you connect your circuit to. There's actually an area for the CO2 absorbent. There's a flush valve in the upper left corner, and there's actually a pop-off valve in the upper right with a little exit where you basically put tubing that goes to the outside. You actually run that tubing out the wall of the operating room for your exhaust gases. Again, before you go on your mission trip, try to find out from your scout what type of anesthesia equipment is available and what you'll need to know before you get there. You know, it was nice. The first day that we get there, we actually unload our supplies. We arrive on a Saturday, but we do not perform any cases until Monday. So that Saturday, we unload all of our supplies, and I familiarize myself with this machine. I make sure that we have plenty of oxygen and that we have the things that we're going to need for our cases. Now, one of the things that I recommend when you're on your mission trip is having team meetings. You can't have enough of these. Communicating with your surgeon and communicating with the nurses, at least 2 times a day. We would meet in the morning, we'd come up with a game plan, we'd talk about the flow of the patients, how they're coming in and out of the center, how we're going to handle the recovery room, who's going to have the medications, who has a copy of the surgery schedule. And it seems very hectic at first because the first day you're there, we had maybe 100 people waiting outside to be seen. But as time goes on and the surgeon starts seeing patients and we start booking cases, by the middle of the week, the rest of our surgical schedule is filled. So by Friday, we walk in the door Friday, we already know the 5 surgeries that we're going to do for sure, and we have a couple people on backup so that if we have enough time, we'll do them too. Okay, so very important to have your team meetings, and it's very important to communicate with your surgeon. Now, looking at these pictures, I wanted to stress the point to you that it's very important to know which cases that you're not going to do when you go on your mission trip. The last thing you want to do is to go on a mission trip and to lose somebody's airway or to have someone die in front of you because you were trying to be a cowboy and trying to do something that maybe is outside of your skill set. This gentleman on the left side here, now he had this huge parotid tumor, probably the size of a grapefruit. And the thing about this gentleman is, the surgeon talked to me and he said, Jeff, the good news is I'm not going to work on this gentleman's parotid tumor, but the bad news is he has a huge inguinal hernia, and I'd like to know if you were comfortable giving him a MAC anesthetic for this hernia. Now, me knowing the surgeon and knowing that he does a great job of localization, and me assessing this gentleman's airway, I could see that the guy was edentulous, he had a nice airway. I felt comfortable doing this case, but still communicating with the surgeon and knowing what kind of cases we will and won't do. This woman in the upper right corner, I'm not sure if you can see that, but she has these massive keloids on her ears. I mean, hanging down onto her clavicle area. And we turned this lady down for surgery because the surgeon felt like, taking these keloids off wasn't going to do her any good because we didn't have the proper follow-up for her to prevent these keloids from coming back. So doing surgery on her would have essentially not done her any good because they would have come right back. And in the lower right corner, Tracy's holding this little guy, cute little guy, but this young boy had a huge hernia, and unfortunately he was about 3 years old and he only weighed about 22 pounds. So he was very malnourished and just not a very healthy kid. And the surgeon asked me if I felt comfortable giving this child a general. And I was just honest with them. I said, this kid is malnourished. I would be more comfortable if this child came back perhaps next year when he's a little bit bigger. Maybe his nourishment is a little bit better. So when you go on your mission trip, it's important to know of the cases that you will and won't do. And again, communicating with your surgeon is very, very important. Now, it's important to remember when you go on your mission trip, have a little bit of fun. I mean, you're working in the operating room all day long. You're doing the best job that you can. And at the end of the day, you want to have a little bit of fun. These aren't the two greatest pictures, but this is just us goofing around. And in the lower picture here, this is us getting back to the airport in Fort Lauderdale, and we're all enjoying a cold blue moon and having a good time before we catch our flights and go our separate ways. Now, there's a little bit of a psychological component of when you return from your mission trip. And what I mean by that is, the things that you see and the things that you do when you're on your mission trip and you come back. For me, I came back and the very next day, my stepson was getting married, and it was a fantastic ceremony, and it was a great time. But we were having a reception at our house for about 50 people, and I'm sitting there looking at these tables and tables and tables of food and drinks, and we had so much food, it was ridiculous. And there's this intense feeling of guilt that came over me. And I know speaking to other people who've gone on mission trips, you do experience a lot of different emotions when you return. And that's also returning back to your work environment. I mean, you're on a mission trip and you see patients that are 5 years old, and you're starting their IVs and they're not crying and they're very stoic and they don't express pain like we do as Americans. And you come back here to the States and you have a patient that's a 25-year-old strapping young man coming in for surgery, and you start their IV and they're crying like a little baby, and I guess you lose a little bit of empathy of what you see back home. And it's just important that when you come home from your mission trip that you process what you saw and what you did with your spouse or a friend or a parent, because it really does do a little bit of a toll on you emotionally. Now, in summary, I know that was a lot of information, but just remember that iceberg, the majority of your mission trip is going to be in the preparation. Preparation, you want to identify an organization, you want to start well in advance, you want to get your vaccinations, you want to contact a scout if you can, if all possible, get as much information from that scout if you can. When you're on your mission trip, make sure that you communicate with your surgeon and with your team every day. Don't do any kind of cases that are outside of your ability level. Even though you're in another country, make sure you're safe. And most importantly, when you return home, make sure you process that mission trip with someone that you can trust in. And as I said before, my name is Jeff Molter, and this is my email address. If you think of any questions or you would like the information packet that I prepared, please email me, and I'd like to email that information packet to you. So happy travels, and thank you very much.